So thank you for joining me. I'm going to just take you through, hopefully I can go through pretty quickly some of the background. I'm sure that not everybody really knows about us here in Calgary, Alberta at the Ability Hub. Some of you might have heard of the Sunny Family Foundation. So I'm just going to briefly take you through. The Sydney Family Foundation was established in about 2008, and it essentially represents the funder for a lot of different activities that we do across Alberta and nationally. And so I'm speaking to you today from our Calgary physical site, I guess, called the Ability Hub. And in our physical space, we run a number of different demonstration projects, but we certainly fund things really across Canada. So if you're ever in Calgary and want to come and see us here, we're happy to welcome visitors, so please come and see us. And our overall vision really is to improve the quality of life for families living with ASD. So we take kind of what we're coining now a 3E approach to everything that we do. We try to enable practices or collaborations or people's good ideas or whatever that might be. Then we take those and we can help in the evaluation of those and export them. So I'm going to tell you about a program today which is in the export phase, and that's our launch program. So again, if you want to come and visit us, visit the website, www.theabilityhub.org. We have about 17,000 square feet of purpose-built space. We are right across the street from Deb Thal. It's nice to see you on the call, Deb. And I'm going to be referencing Deb's work, actually. So Deb is right across the street from us at the Children's Hospital, and we've been working together for a number of years. So hi, Deb.
Hi, Caitlin.
Nice to see you, or talk to you anyway. So we have 5 key areas of focus. Oh, that kind of went really fast. Don't you love those automated slides? So we currently kind of focus in 5 areas. One is building life and work skills in individuals with ASD. Our second area is assisting with lifespan planning and navigation, and that's what I'm going to talk mostly about today. The launch program really fits in that second area of focus. We also have a focus on housing and wraparound supports, and we try to improve the skills of caregivers and professionals, so that's families and psychiatrists and dentists and anybody who really touches the lives of individuals with autism. And our 5th area of focus is trying to, I think we don't say influence anymore, what do we say? We partner with government to try to support or advocate for policies to improve lives for people living with autism. So we have essentially two core programs at the Ability Hub. One is our Resource Center, which is staffed by a team of parent ambassadors, all parents who have children on the autism spectrum and who come from a variety of different backgrounds. And they staff our Resource Center, and that's open to anybody, anytime. If you have a very young child, or you're just questioning whether how you might go about diagnosis, or you just have general questions about autism as a provider or a practitioner, that's the Resource Center. And then the Launch program is our other core program, so I'm going to talk more about that. And the shared goal of our 2 core programs is in this second key focus area, which is to provide lifespan planning and navigation support for families and caregivers. We have a couple of different demonstration programs that we run at the Hub. You might have seen something on the national about the Peers program, if anybody watched that little clip. So we run Peers, which is the social skills program. We have a new national program called Worktopia, which focuses on employment readiness, and that has a number of different partners across Canada. We have a program, also a federally funded program called Meticulon around IT employment, and that's for people with computer skills in the stratosphere way beyond my ability. So really kind of high-end computer work. I run a program called Mind Balance for ASD because this population, we see a lot of anxiety and mental health issues in the ASD population. We have life skills training programs, employment training programs, We had another federally funded program that really focused on placing people in the workplace. It's kind of on hold right now, waiting for more federal funding, and a family managed day program and some social recreational programs. So we have a lot of different things going on, but again, our goal here is to enable programs, evaluate them, and then export them, and not to run them here forever and ever. So that's just a view into what our resource center actually looks like. It's a pretty standard resource center. And then I don't have a picture of my office or the office of my fellow clinicians, so you'll have to make do with the logo. And I'm going to tell you a little bit about the launch program now. So the launch program was essentially created for this, to address this issue. And for those of you in the transition world, I really feel like I'm speaking probably to the choir here, but definitely most things for most services, most supports really fall apart at the age of 18. So Wile E. Coyote's my favorite cartoon character. He always seems to be falling off the support cliff. And so we certainly saw that with our families and our individuals here in Alberta, that once they turned 18, many of the kind of supports that they'd come to know and rely on were going away at 18. So we started a program called Launch. We saw our first individual client, and we did see people individually, the individual with autism plus their family in most cases. And we saw our first client in March of 2012. So several years ago, and we learned a lot by seeing families individually one by one. We tried to make it easy, because what we understood for a lot of families was that transition planning wasn't easy. Many families, as you're all aware, I'm sure, kind of are caught up in the day-to-day activities of just getting out the door and getting to school and getting to appointments and that kind of thing, and weren't really looking into the future, or if they did have a peek into the future, it looked really scary. And so for many families, they were just kind of not doing it or not kind of knowing how to go about it. So we tried to make it quite easy for families. And so basically we tried to focus on answering these three key questions. So where are we now in terms of, is this child with autism 13? Is he 23? Is she 43? And we certainly have seen people all across the age span. I think our youngest clients are 13. You need to be 13 actually to access the services and programs that the Ability has. And I think our oldest client is 57. So we have definitely seen lots of clients across the age span, across the Ability spectrum as well. And we really wanted to meet families where they were at. Where are we now? And so I'm going to go through kind of how we did that assessment across 5 domains. The next question was, where do we want to go? And this really is a priority goal setting exercise that we like to do as a team. So certainly sometimes, as many of you can imagine, parents have a goal, children have a different goal. Maybe it's the same goal, but if we're not kind of all moving in the same direction, we really don't get very far. So trying to do this sort of priority goal setting, what's the most important thing, what's something we can all agree on as a goal to set, so we can start working towards that. And then the third question is, how do we get there? And so we tried to put something together that's very similar to an IPP or an IEP that you might receive in school, where you lay out your goals, but then you also lay out your sort of strategies and supports that are going to be needed to obtain that goal, and we call that the ITP, or the Individualized Transition Plan. So this is, again, you're going to have to put up with my morbid or weird sense of humor around Wile E. Coyote, but I really felt that this slide represented kind of a lot of families that we would see, or parents, where they're quite fixated on one goal. And that for many individuals, that was the education goal, sort of the educational attainment of either a high school diploma or getting into post-secondary education setting. It seemed to be sort of really a fixation for a lot of families, and we understand why. Certainly obtaining a high school diploma, if you can do it, is a really important thing. And so we certainly support families to help their children finish high school and to obtain the highest level of academic achievement that they can. But then we also want them to think more broadly about the other things that are going to matter for their adult child besides just education. So we tried to develop what we call our 5-domain model. And you'll see in the gray box, education and employment. So we kind of put those two together and said, yes, we agree education and employment is really important in terms of the long-term future and economic viability and sustainability of your child in the world. And that's important, and we talk a lot about that as well. But then we also wanted to make families aware of the other domains that were also important. So basically it's sort of cheating because there's really 10, but we just call them 5 domains and we just use an ampersand in the middle. But if we start at the top, we talk about health and well-being being important to understand and think about, education and employment, communication and social relationships, independent living skills and self-advocacy, and legal and financial issues. And for us, when we sit down with a family and we either do a formal assessment process or we started kind of with an informal, or pardon me, a formal assessment process where we had people filling out all sorts of different kinds of forms and surveys and assessments. And then we moved to more of a semi-structured clinical interview. And then we moved even further away from that to sort of more of a priority setting domain exercise. We really wanted to capture important elements of each of these domains in that conversation and in those meetings with families to sort of be aware. How are things going in these domains? Where are you at, as a 13-year-old child or as a 23-year-old child? What's going on for you in terms of your ability to communicate? What's your social relationship network like? Do you have any friends? How connected is your family? Those kinds of things. So this helped us get away from the problem, which was many families would come to us with their sort of burning priority, the thing that was sort of most urgent for them. And as I said, often that was education. It might have been another issue, a behavioral issue or a communication issue, but we wanted to say, okay, we're here to help you with that problem that's really immediate, the proverbial fire that's burning you right now. But we also want you to think more broadly about going forward, what are going to be the things that are going to be really important to also have in our scope or in our view. So we started in 2012 talking and having conversations with families, doing this sort of systematic interview conversation with families about what was going on for them and developing individualized transition plans. And since 2012, we've probably seen 470-ish families individually. So that's a lot of families, aged, so as I said, 13 to 53 or 57 or something like that. So very kind of broad, opportunities for us to see a really broad range of families and people who were their own guardians, people who had been employed, people who were still in school, a variety of different family compositions and whatnot. So I think we have developed quite a lot of expertise in terms of at least knowing where the gaps and issues and barriers were for families in terms of transitioning to adulthood. As I said before, in our triple E model, enable, evaluate, and export, we did a comprehensive evaluation of what I call phase 1 of the launch program, which was our offering launch to individual families one by one. We have a team of clinicians. There's three of us full-time and 2 part-time. We have a fairly big team here, but even with that team, 470 individuals was starting to become a very big caseload. And so we have had to look at how do we make sort of the launch program more broadly available to individuals so that we're not just serving, for example, families who can drive to see us at the Ability Hub, but also families who need to sort of engage in a long-term relationship, or maybe they live, maybe they can't do that, they can't see us during daytime hours and whatnot. So we've had to sort of switch our model of delivery, and I'll tell you about that next phase. So we're calling phase 2, if you like, Launch into Life. So whereas Launch was more individually focused and one family at a time with one clinician as sort of the lead, or one member of the transition team, we've moved to a group-based training model now. And the transition workshop series that we've developed currently, and it's pretty new for us too, is delivered in 3 sessions. It covers the transition to adulthood. We have a suite of transition planning tools that we offer over the course of those 3 evening sessions. And topics include things like preparing for key life transitions, managing mental health and health problems, finding programs, and whatnot. And I'm going to, in the next slide, direct you to how you can find out more information about those. So I'm hoping this is going to work. If I click on this, maybe it will bring up our website. Is that working for people? Yes? I just need one yes. Okay.
Yes.
So, okay, great. So on the Ability Hub website, you can, if you go to the home page, obviously that's the screenshot that I showed you before, and if you go over to the program tab, you'll see all of our different programs. You go to the launch program, you'll see the launch team, and then Launch into Life workshops. So this is just a little brief description about the workshop, kind of what we cover, and in fact, as it turns out, our another session is beginning tonight. So at 6:30 tonight, we'll be starting another one of our Launch into Life workshop series. There's a one-page PDF that kind of describes what you see here on the screen. And we had, I think, 35 families last session, and we have about another 30 families this session. So from one perspective, this is giving us the opportunity to see more rapidly. Whether that's actually going to be agreeable to families, we don't know yet. We got pretty good reviews the first time we did it, but families are still wanting that individual hand, guidance one by one, and we're going to try to do that through our resource ambassador staff. So the other tab I'll just alert you to is the 3rd tab in the launch program, which is the launch resource guide, which I'm going to talk to you a little bit about now. So it is available online. You can just click on this link and it will take you to the PDF of that. There are some embedded videos within the guide. So if you were to open up the guide, we're going to get here, and I'm just going to walk you through a little bit of that. So the guide itself is about 100 pages. We have printed copies of them. They're a bit expensive to print, so we're trying to move a bit more to sort of an e-copy, but all of the participants at the workshop get a printed copy of the guide. I'll just go to the index quickly, and you can certainly navigate through this yourself, but basically we have sort of some early facts about autism, kind of what is transition planning. And this guide was very much informed by a very broad committee that Deb was part of for several years, actually, and all 5 school divisions here in Calgary, and a number of health and mental health providers, and it was sort of informed by a big team of parents, and et cetera. So, and this is the 2nd version of the guide, actually. So I will just kind of draw your attention to the domains. So we have a kind of a chapter about each domain. So there's a chapter about health and well-being, and a chapter on education and employment, et cetera, et cetera. And then we get down to page 71, which then is something called the transition planning timeline. And this is basically sort of a checklist of things that you should be thinking about between the ages of 13 and 14, for example, or maybe some things that you might want to get done when your child is sort of 15, 16. And certainly, as many of you are probably well aware, we have some parents who haven't really done maybe some of the stage 1 or stage 2 tasks and come to you and their child is just about to turn 18 and there's kind of a panic to get a lot of things done. And so then we kind of have to go back and sort of see where we're at. But ideally, if this timeline was available to families and they could start to at least think about some of the things that would be good to get done when their children were younger, it wouldn't be so overwhelming when they were just about to turn 18. That's the idea. And then we have, starting on page 78, a resource appendix, and these are kind of grouped into general supports and then supports and resources per domain, if you like. And these are quite specific to Calgary and Alberta. There are some sort of national or international resources that we've referenced. But I think if you were to take a guide like this and sort of customize it for Nova Scotia or Saskatchewan or British Columbia, this would be the section where you would need to sort of put in your own local community resources and funding models and government websites and those kinds of things that are relevant to your community. And the last thing on page 90 is what we call the Individualized Transition Plan. The version that we have in this book is actually quite small, so we print them and use them electronically. But I just wanted to show you sort of the simplicity. This is not rocket science, even though coyotes on a rocket, it's not rocket science. I mean, we try to keep it very simple. What would be a goal that you and your child or your transition team might want to work on in health and well-being? There might not be a goal. There might be 2 goals. And you would just write those goals in here. You know, it's a writable PDF, so you could put them in here, you could print them off, or whatever you want. And then subsequent to choosing a goal, we simply want families to think about strategies. Maybe we provide some strategies that would help you achieve those goals. By strategies, I mean things that you can start right now at home as a parent, as a caregiver. What are some resources? And those resources might be in the area of a support group, something that you might want to read, a book, or you might want to go to a website. And then finally, and I would say the smallest category is programs, because we know that, first of all, there aren't a lot of programs that are going to meet the needs of our children with ASD. They might not be ASD specific, or they might be expensive, or they might be short-term. And so we really want to try to move families away from the dependence on programs as the sort of go-to first thing. I have a goal and I need a program to solve it. But rather saying, okay, what are some strategies you can do and your child can start doing, and what are some resources that we can point you to that are freely available, already exist in the community, versus let's build another program that's going to meet the specific target population's needs for 12 weeks, 2 hours a week, or whatever. And so that's where we're going. Anyways, that is the guide. I am going to try hard to go the back arrow. No, let's see. I don't think I have to go back to there. Okay, let me, I've lost my presentation somehow. Back.
So it should just be at the bottom of your screen, maybe? There you go.
Should be back now.
Yeah.
Okay. So those were just the 2 links I wanted to take you through. And Lisa, I'm happy if you want to share this set of slides, or I could send it to you afterwards. But it's pretty easy to find from the Ability Hub website. The description of the program and the guide is there as well. So just briefly, kind of the core elements of launch transition planning are really a shared vision for the future. Stumbling blocks, sort of the first stumbling block, if you like, is that either families have a very clear vision of what the future is going to look like for their child, or they don't share the same vision. Perhaps the child, sees something for themselves different than the parent does. Building a transition team. And I put the orange emphasis on team because what we usually see, and many of you will share the same experience, is we see the individual or the client or the patient and a very tired mom, and that's the team. So we're really trying to broaden that team to include, other people in the network, an extended family, a school teacher, a neighbor, somebody who also can sort of be on that team. The transition priority checklist, that is also included in the guide, and it's just really a way of having families kind of tell us what's the most important thing to them right now and how can we start there. And it's a rating scale. It's a very simple rating scale between 0, it's not a problem, to 3, this is a very pressing concern for us. And the categories would be things like mental health, school, employment, those kinds of things. And that helps us have a really good focused conversation right off the bat in terms of what is a priority for you right now, your family. The 5 domains I've gone through, the transition planning timeline I showed you or described to you, which is just all sorts of things that are more related to tasks. If you need to apply for guardianship, have you got a capacity assessment completed? Does your child have a social insurance number? Do they have photo ID? Do they have a relationship with an adult care doctor? Or are you making plans for when your child can't see their pediatrician anymore? Who are they going to see as their practitioner? And then the individualized transition plan, which I described, which really just has goals, strategies, resources, and programs. Okay, and I just have a couple more slides to go through, but basically that's the launch program in its entirety. It's, I think, pretty simple, but still, even as simple as we've tried to make it, it is still overwhelming for parents. The feedback we got after 3 workshop sessions was, oh my goodness, there's so much information. How could I possibly even know where to start? So I'm going to take you through what I hope you will all find a little bit amusing, but this is the question I get most frequently. So if you had to pick a population of families who come to us to talk about transitioning or creating a transition plan, it's mostly people call you in about January or February or maybe March of the year that their child is graduating from high school, and they say, my child's graduating from high school this June, what should the plan be? So I say, well, plan A, if you notice the question is plan B as a B, plan A is full-time post-secondary studies, and that's the one that parents want me to agree to and say that's a really good plan, and then I don't usually agree with that. So then there's plan C, which is full-time video gaming in the basement. I don't agree with that plan either, but that's usually where things go for a lot of our children with ASD because they don't go on to full-time post-secondary studies, or if they do, they're not very successful at it, and they're not really ready for the work world either, as many of our neurotypical kids aren't either. So then I try to suggest plan B, which is my plan. So I hope you'll all just find this amusing. So this is me. That's actually my face and my real body. And then it's supposed to, oh, I don't know if it's going to, it's supposed to be an animated slide. Can anybody see the animation? No. It's very sad.
No, I don't. I'm assuming you're juggling.
Oh, it's not juggling. That's the best part of the whole slide. Oh, well. Anyways, moving right along, the first ball. So this is what I try to present to families as a better plan than full-time post-secondary studies. One is a plan that involves some social recreational activities, and it's my number one suggestion because if you don't have social recreational activities for individuals that they enjoy, then there's really no motivation to get up in the morning or to be happy or to really do anything else. And social recreational activities is really the last thing parents think about. and they've kind of gone away from thinking that they need to be involved in signing their kids up for recreational soccer or whatever it might be. And so, and they've had some negative experiences around social engagement perhaps, or their children have been bullied, or they really don't like the whole social interaction piece, and so they really shy away from it. So a lot of the kids that I see who are in their late teenage years really have not much going on in the social recreational domain, if you like. Then I talk about continued learning, very different than a full-time post-secondary program. And that learning might look like an evening course at the University of Calgary or Mount Royal University or the YMCA or the City of Calgary, or some kind of continued learning in photography, accounting, world history, something, just to kind of keep in the mode of going into a classroom, meeting with other people who kind of share your interests in a topic area, and to continue that learning process. And then the third piece is a part-time job. And I really think this is achievable for almost every individual with autism. This is delivering flyers. This is 2-hour shift, working at your church, or it's a part-time job at Subway, or it's working at your uncle's lawn care company. It's something that requires that you have a boss, you show up on time, you wear appropriate clothing, you have responsibility. So that's my 3-point plan, or my 3-ball plan. I'm very sorry that my juggling didn't work out, but I'm not a really good juggler in person either. And this basically is what we're trying to prevent, and this is what we see much too often, is that at 18, Wiley falls off the support cliff. There is no plan in place. There's not an ITP in place, and there's not sort of either or the more simple version of a 3-point plan in place. And so we see a lot of kids that just end up in the basement, if you like. So our program really is encouraging families to take the long view in terms of what is my child's long-term future looking like, where are they going to be when they're 35, where are they going to be when they're 55. This is a hard conversation to have for families, but it really is much more of their life to plan for than has existed to date. And to also take the wide view, which is the broader multi-domain view, as opposed to sort of that narrow focus on education or employment. And that's the end of my presentation.
Thank you so much. That was wonderful, Katelyn. Just going to open the floor and see if anybody has any questions or comments.
Hi, Katelyn. This is Deb Sewell. I just wanted to thank you for coming and presenting to the CAPHC Community of Practice. It is an incredible resource, and it's awesome that it is available online, so you don't even actually have to be in Calgary. You could take it and make the resource applicable to your province, location, wherever.
Yeah, absolutely. And my thanks to you again, Deb, for providing a lot of the content actually for this, and for multiple and copious reading and proofing of this document. I did want to say, in terms of its availability to other places, this is the first piece that's available, the guide. We are planning on putting on the website all of the tools, the individual tools, the PPC, the checklist, as individual documents, and then we're working with STATE to do some video modules so that if you actually couldn't physically come to the Ability Hub or to one of our schools to actually take the Launch into Life workshop in person, that you would be able to do it online. So that's kind of our probably next 18-month plan, is to offer the workshop in other locations, start offering it in the school system, which I think is really where it belongs, and then and with other community partners as well, and then offering it in a sort of web or video accessibility space, so that people can do it at 10 o'clock at night when they finally have a minute. They can watch it over and over again, and they can use the tools themselves.
Great. I have a question here from Mary asking, do you have any funding available for families who cannot afford the $75?
We don't. We waive the fee if you can't afford it. Yeah, it's really only to cover the cost of the printed materials. But yeah, it's not. We don't require people to pay $75 to come. But many of you who've run workshops before know that if you offer free workshops, sometimes you don't get the
Right.
same buy that you do when you have people register online and pay a
Mm-hmm.
small fee. Certainly doesn't cover the cost of offering the program. So it recoups some material costs. It doesn't pay for staff time at this point. So that's really another reason why we'd like to make it available online, is so once we've actually done that, then many people can benefit from it, and many places can run it at just whatever they can afford to pay their facilitators if they want to do it in a face-to-face way. And if they don't want to do it or can't do it in a face-to-face way, the people can do it online.
And I have another question here. Could you share some of your experiences with evaluation of the program and sort of what tools or measures have you used?
So we had an external evaluation completed by Dr. Veronica Smith at University of Alberta over the summer, and that really kind of multimodal, I suppose. We had qualitative interviews. We did an online survey of families that we had met with. And I'm happy to share the results of that with you. But basically, the key findings were that we were interested in knowing a little bit about obviously our demographic. I mean, who had come, who had we seen in launch, what were the key issues that they were facing, and they were kind of all over the map. So in some ways, that was exactly what we knew in the development of the domains, or the development of what we call the parent or participant priority checklist, that everybody's coming to us with a different issue, or multiple issues. And so we saw that reflected in the survey and interview data. And then the other question we really asked about was, how effective was the launch process for you? And so, not to pat ourselves on the back, but we got pretty good feedback that people had found the launch process helpful, and they liked the face-to-face, individualized planning conversation. Because if I really had to define what launch is, I would say it's an informed conversation about the future. And so they liked that piece. What we didn't see as much was people following through on their plans. And so when we investigated a little bit more, okay, you have an ITP, you have goals, you have strategies, resources, and programs perhaps attached to those goals. How's that going? What we heard back were two things. One was that the family wasn't ready, or the individual wasn't ready, or didn't agree with that goal. So then that makes us have to go back and say, okay, maybe we as a team, or maybe we as clinicians, or maybe we as parents picked the wrong goal. Or maybe there's an element of readiness that is there for any intervention that you do, like smoking cessation, right? So are people really ready to quit smoking? Are they really ready to take on some new activities in the social recreational domain, for example? Are they really ready to lose weight? Are they really ready to apply for college? You can want to do it, and then doing it is another thing, as we all know with our New Year's resolutions. Have New Year's resolutions, whether we act on them right away is another question. Does that answer your question?
Yeah, it does. Thank you so much. And actually, I'm excited that you bring up the whole notion of goal setting and evaluation of that. That was very similar that we found in healthcare transition with the TRACE study, that may be a very concrete way of setting goals, and then also allowing you for evaluation, and to both at the individual level as well as the program level.
Right. And I just find sometimes it takes a long time to get to a shared goal.
Sure.
We have a lot of conversation, and a parent priority might be that their child get a job, or go to university, or start shaving, or whatever the goal might be. And if that's not the individual or child's goal, it's really hard to make traction when what you're meeting with is resistance to achieving that goal.
Mm-hmm.
And what we know is we can't work harder than our clients. And we did learn that in our 470 families, that for many families we were working very hard to establish individualized transition plans and to put all sorts of excellent resources and contacts and offer people books and websites and things. And when we didn't get callbacks or we didn't get patients or clients following up with us, there's a tendency to think, well, did we do something wrong? Well, I don't know. Maybe what we did wrong was we worked harder than the client or the family was ready to work at that point.
So, any other comments or questions? Or Mary, do you have anything? You have a
full house out here in BC.
Yeah, I know you got a full room.
Yeah.
So.
No, we're just really thrilled to look at this as a resource that we can link our families and our youth and our staff to, is for sure. And the BC Pediatrics is a project going on transition, and they're specifically interested in the youth with autism. So we'll definitely share this resource with them. Thank you.
Great, good. I should just mention that probably in the course of the next 3 to 6 months, we'll be doing some out-of-province training on launch. So I was in conversation with someone from Autism Okanagan this morning. There's Monarch House in Vancouver that wants to do a training. Asperger Manitoba wants to do a training. Edmonton wants to do a training. So, I'll just say, we're happy to do trainings. We're kind of early in the stages of export, if you like. We're shifting to a new model. We'd like to take some time to sort of see what the workshop model is like in terms of meeting families' needs. I do know that we won't be able to go back to a one-on-one, individual, one family at a time sort of model, but anybody could really, with any kind of interest or investment, take the guide. All the tools live in the guide, not any other tools. They all live in the guide, really understand what the guide is, the process, and actually work through that with a family. It doesn't really require us to come out and train facilitators. We're not trying to export the program in that sort of way. We're happy to come out and share our experience and to put on a workshop for families. So I think in BC, that's the model that they've chosen to do. They want to host a workshop and then have us come in and deliver it for one time, but that isn't necessarily how it has to go. People can come here and meet with us, or there's a number of different ways really to share that information. And like I said, there's no cost to any of this for our families really, or for us in sharing the materials. We have invested a lot of time and money at the foundation in sort of developing it, and we just want to make it broadly available. So if you are interested in knowing more about it, feel free to email me or talk to me about how we can be helpful.
Great. I have one final question here for you from Scott. So could you please share your experience with the Employment Works Canada pilot program, and how well did it integrate with the launch program?
Okay, so Employment Works is new for everybody. We're just starting, we just started this week our second cohort of the Employment Works piece. The broader name of the project is Worktopia, and there's a Community Works arm, a School Works arm, and an Employment Works arm. So just to be clear, I'm going to speak just about Employment Works, which is based on a population of individuals who are out of school. Typically they're 16 and over, maybe 18 and over, and this is a population of individuals with autism who are interested in seeking employment but maybe don't have the readiness skills that, or some of them have had actually jobs and then not been able to maintain them for whatever reason. So the programs are not linked other than the lead facilitator, a colleague of mine here at the Ability Hub, Mike Barrett, who has worked with me in the launch program, was instrumental in the Peers program, and is now the facilitator for the Employment Works program, is leading that. And we don't use the launch transition planning process or assessment process prior to taking somebody into EWC. There's a completely different sort of assessment process and whatnot that people are going through. But I would say that Employment Works really focuses on employment and having people ready for employment. It doesn't necessarily target the other domains, so it's not a mental health support program, it's not a social skills training program, it's not a communication program, but within the curriculum over 12 weeks, there are elements of those things, but they're geared towards you as an employee. So how do you as an employee communicate with your coworkers? You as an employee, you know, what independent living skills might you need to show up at work on time? Maybe that's learning how to take the bus or set your alarm or whatever it might be. So they're separate programs. That's what I can tell you about EWC, Employment Works Canada, at this point.
Good. Thanks very much.